First off, as we talk right now, where does North Mississippi Health Services stand?
Well, I mean, I think we stand the same place we've always stood, in the sense that we stand to provide care to our community. Now, the challenges and what are very dynamic with COVID are not just COVID. It's that people have delayed care. And so when they come to our hospitals or to our clinics, they're sicker than they've been in the past, than 3 years ago, say. So part of the challenge that we also face is that over the last 2 years, 2,000 nurses have left Mississippi. Now, this isn't Mississippi independently, this is the nation. So there is a bit of a staffing crisis as well. And then, of course, everybody's seen the supply chain issues, and that affects healthcare also. And then, COVID is a very, frankly, contagious virus that causes a lot of people to be sick. And then the last part is a lot of it's been politicized, and that makes it very challenging. So where we're at this moment is we continue to use a very systematic approach to respond and escalate or de-escalate our care. To give you examples, 2 weeks ago, we tightened, or maybe 10 days ago, we tightened our visitation. We canceled all in-person meetings of greater than 4 people and canceled all eating at meetings where we think a greater risk of getting infected is. And then we continue, with very strong masking requirements. Since then, we've escalated again. So we have brought in different resources by putting the whole system on alert. We have brought in ancillary nursing from different arenas that were, maybe they were in an inpatient or hospital acute care setting, and it's since moved to a clinic setting, and we've asked them to come back and help out as we've done before. We have used an algorithmic approach, and what that means for your audience is that we sort of, if this situation happens, we do this. If this situation happens, we do this. And what is different about North Mississippi that has developed and strengthened over this period of time with COVID than, say, before that, is we really are responding as a system. An example would be, last night we found that our emergency department in Tupelo was overcrowded, and our West Point one wasn't. So we got on a call that involved all the institutions and said, okay, how are we going to manage this? West Point, can you take some of the burden of our care? And so we then created movements of patients at times to West Point. We've done that always, but in the last 2 years, at least since I've been here, but that's a very supported system approach. It is difficult for patients. The patients and the families that are in our communities need to recognize we are committed to putting the patient in the safest place to receive their care. And sometimes that isn't going to be Tupelo at the moment. It's going to be in West Point or Amory or even Iuka or Pontotoc, depending on the clinical situation. And we're using a very similar approach to delivering care, so we feel that we can be consistent. So it really comes down to getting them in a hospital bed with a nurse, with a doc that can care for them.
I want to circle back to employees and staffing in just a bit, but just want to clarify. Your ER is seeing more people showing up. Is it COVID? Is it the flu? Is it both? What?
Well, I actually did a public service announcement yesterday, and that public service announcement that's out on social media reflected that a large portion of the increase in volume most recently has been people seeking testing. The real challenge with that is we also have this very high level of sicker patients. So the answers to your question were yes, yes, and yes. So we are seeing a sicker level of patient than we've had. In fact, we've created another inpatient care unit in the emergency department right now, as we have to try to manage more patients with less nurses at times. So we actually manage some patients in our emergency department in a separate area as if they were admitted, and then move them up as the bed opens up, or we can actually move them to a community hospital. What makes that really challenging is if you have patients that could be taken care of at a clinic or an urgent care coming to the emergency department asking for care, because when they walk through that door, we don't know their level of illness. So we treat everybody the same. And if they could be taken care of, even if it's a wait, if they could be taken care of in the primary care clinic or in an urgent care clinic, and they don't need to be admitted to the hospital or aren't severely ill or just need testing, that is the key places for them to go to help us focus on those who most need emergent care.
I know in the last wave, we had, or you had members of the military come in to help assist. Is the hospital system in a position, or I guess really North Mississippi and Tupelo, are you in a position now to where you, even though you're seeing more people, you're not going to have to rely on government help again, or is it just too early to say?
Well, one, it's not available at the moment. I mean, that really has to be a state, the governor has to put us back on an emergency crisis setting. And the state has to reach out to the Federal Emergency Medical Assistance Team, FEMA, and our local one, which is the Mississippi version, NEMA, to provide that support. That has not been an option offered to us at this time. We are managing, and actually our folks are doing Herculean and incredible work. We just are doing it with less people than we've had in the past. So I don't think, I have a prayer. It's my critical care prayer. It's, dear Lord, because I'm a critical care doctor, dear Lord, let me be humble so you don't have to humble me, because it's very painful. And when I am humbled, let me learn from my mistakes so others don't have to go through that. So if we were to be offered that kind of care, I think we would be very inclined to accept it. Are we at a place where we could use it? We certainly could use it. We're still managing patients in our ED, and I think they're better managed, or it's a better environment for them to be managed. It's more private, and a lot of the things that we think about when we're in a hospital are easier to provide in a different setting than the emergency department. So I think we could use that support. Can we provide safe and good care without that support right now? We can, and we are.
Gotcha. I'll try to keep it to two more questions and cut you loose after this.
Certainly.
Actually, I do need to ask you about monoclonal antibodies. I know the hospital system announced earlier this week there's a reduction in that, or the availability, I guess. Correct me if I'm wrong. That's basically the hospitals across the state get assigned certain amounts of that, right? Explain how that works.
Yeah. So what happens is there are really 3 monoclonal antibodies right now that are available or have been available. One of them is called BAM-EDI, is sort of the name for it. It's 2 complex names. And the other one is called Regencov, and that's the one that's given subcutaneously. Those 2 have been found to not be as effective against Omicron. And although we don't know for sure the percentage of Omicron in our communities, with conversations with Dr. Dobbs from the Mississippi Department of Health, he feels from the data they're receiving, it's about 50%. That means shortly as that increases, those monoclonal antibodies will be less effective. Because of that, the federal government has said, we're not going to distribute those anymore to you. And so we're using up those supplies, and we do about 500 a week, and we anticipate those being used up over the next week. The one monoclonal antibody that is effective against Omicron is called sotrovimab. And but unfortunately, that is very limited supply. The state of Mississippi received 126 of those this last week. We got 40 of those. So what we're doing is, since we think Delta is still very prominent, is we're finishing out treating with the monoclonal antibodies that we have, and then we will convert to the sotrovimab, which has to be given with an infusion, can't be given sub-Q. And what will happen is we'll have to go to much stricter criteria. So the data that we sent out this week said 3 things. One, we think, 4 things. One, monoclonal antibodies are really important in our strategy to treat. Really, the other thing the other 2 things that are just as important are masking and booster shots. But that the monoclonal antibody is the one thing that we could use in any patient population to prevent them from getting seriously ill, whether they've been vaccinated or not, boosted or not. The second thing that we wanted to say in that announcement is that we don't know when, but in the near future, Omicron will be our prominent variant. And when that happens, the BAM-EDI and the Regencov will no longer be effective. And so we're using up those doses. And because of that, we're not receiving any doses either. That's not us. That's the federal government to the State Department of Health. And then the last is that the one is effective will be limited doses, and we will give those with very strict criteria, but we will run out of those very quickly. I actually had a conversation with one of our representatives today and Dr. Dobbs to try to help Dr. Dobbs get more attention at a national level, because Mississippi needs this medication. My neighbors need this medication, and we're going to fight to get it. But if we don't have it, we don't have it. So my plea is please wear your mask appropriately. Please get boosted. Yeah, it's the pits. I am not enjoying COVID, if anyone wonders. You know, I came here to December 9th, 2019, and within a month, COVID had spread. But I love this community. I love my team. My team is incredible, and they're with honor and dignity and strength, and help us to help you by taking care of yourself, because we've had over 525 deaths in our system. We're really, if you look at our community hospitals, we're over 650 during this COVID experience. And many of those didn't need to die. They've been vaccinated and wore a mask.
I'm sure you've been asked this question multiple times throughout the pandemic, but I will ask it now, especially with Omicron, New Year's Eve. You know, there are people who plan to get together. We've got Ole Miss fans, I'm sure, going to New Orleans for the Sugar Bowl. With everything we've heard now, and with, you know, we kind of opened back up and kind of let our guard down a little bit. Now I think everybody's kind of aware of what's going on. What's your advice to somebody as far as, are they okay to go to a ceremony or a gathering on New Year's? Are they okay to go to the Sugar Bowl? I mean, that's a broad question, but I think that's top of mind of everybody who's watching us.
Yeah, I think there's an iterative response to that, or, you know, a response based on what your decision is. So my first response would be, you know, if you want to be as safe as you can possibly be, then wear your mask and only interact with those who interact on a regular basis. You know, avoid sitting real closely during meals if you're not going to wear your mask, and don't go to those big events. On the other hand, we got to live life, right? I mean, this is life we're living in, and so I get it. So if you're going to go to the Sugar Bowl, if you're going to fly, if you're going to go places, then do your best to protect yourself and others, because you could be infected and infect them. So I wear my mask not so much because of me, but because I care about you, Craig, because I don't know what your story is. I don't know if you might have a family member that's at risk, or a child or a parent or wife or yourself. So out of my respect and love for you, which is what Southern hospitality is, I wear my mask. So if people would do that when they go to the Sugar Bowl, even if it's outside because you're so close together, if you just wear your mask appropriately over your nose and mouth, then I would be supportive of you being able to attend that experience, because it's such an important one in your life. I'm a big sports guy. I'm a diehard Cowboys fan. So, you know, I want to be able to experience those kind of things too. But when I do that, I wear a mask, even when it's uncomfortable. You know, when I'm a hunter, when I go into a hunting store, I'm often the only one wearing a mask. But I just pretend like, you know, that's my right, and I don't feel bad about it, and I try not to feel bad about anyone else. I think we need to meet people where the other person is, love them, assume good intent, and be respectful. And if we can do those things, and please, if you could, wear your mask and consider getting boosted, I think we can really manage this variant spread. But it's people refusing to wear their mask because, I don't know. I don't really understand why they don't. Then that's who's going to get infected or infect others.
Okay, I promise this is the last question.
Oh, you can ask as many as you need. This is important.
I've heard a variety of medical professionals say, like, for example, I've got a cloth mask. That's what I've been wearing. I've heard some say, because of Omicron, you really need to step up to an N95 or a KN95. What's your advice?
Yeah, I think in the end, I want to give advice that the everyday blue collar person could, or white collar man or woman could do. And so, if you're my friend who I hunt with down in Kosciuszko on his cotton lands and property, or whether you're, one of my professor friends visiting me from Washington, D.C., my advice would be is wear the mask that you will comfortably wear appropriately all the time. And personally, I do like to wear an N95 when I fly, just because you have no choice, you're sitting close to others. But other than that, I wear a procedural mask, which is, more of the medical kind. As for the cloth mask, we do have a special cloth mask that we've given to our employees that has zinc and copper in it, which has been FDA approved to kill the virus. So that cloth mask is supportive. I'm not as supportive of a regular cloth mask, definitely not as supportive of the gaiters or bandanas or face shields. I mean, face shields are good for the eyes, but still it's the breathing in and out. So I'm comfortable with you wearing your cloth mask if that's what you have and that's what feels comfortable to you. If you were my brother and you were going to listen to my advice, which you might not, I would recommend you wear a procedural mask and that you just avoid situations where an N95 was required, such as visiting somebody who you know is infected or sitting in a very tight, closed space for a prolonged period with folks who you don't know if they've been very diligent. Then that's the place to wear an N95 in my mind. I don't think that that's consistent necessarily with the most conservative recommendations, but I think you can live with that. So for me, and this is the God's honest truth, my wife wears a cloth mask. I just make sure she wears it everywhere we go. I wear a procedural mask. My daughter, when she flew over, was wearing an N95. God bless her. So, that would be my thoughts.
Okay,
and
real quick.
Your hands.
I do want to stress again. A procedural mask is what?
A procedural mask it's a mask that's made of a special material. You can see that there. They often look very similar to that. There are black sort of fake ones that aren't really procedural. They're made of a different material, but this material is specially designed. And what it is that it's curly material that are sort of don't allow there to be any straight holes through it. So versus a Swiss cheese effect, this is really like putting little tiny hairy barriers all over that the virus hits when you breathe through the mask or breathe in the air and through the mask. And the problem with the cloth mask, if you don't have the copper and the zinc built into it, is that it has bigger pores. So those pores can be aligned every now and then, and a virus could get through it because it's very small. Now the N95, what it does is actually totally seals. So if you see this mask, even when I wear it, there's little tiny air openings right here. So it's not as effective as an N95. But I think if everybody said, look, we'll all wear masks if you just give us cloth, then I'd say, hallelujah, you all have cloth masks. Whatever I can do to get people appropriately, this is the one that's really hard for me when people do this, because they think they're getting away with it. And then I have to ask them, could you please put it over your nose? And that this is a very passive aggressive approach in my mind. This one I call the drool catcher, because that does absolutely nothing except catch pieces of food.
Dr. Jeremy Blanchard is Chief Medical Officer for North Mississippi Health Services. Dr. Blanchard, thank you so much for joining us.
Yeah, if I could say one last thing, and that is thank you to everybody. I know this is tough, but the support that you have given my teammates and the support that you have given us to try to care for you, it is unmeasurable. And I would just ask you to not give up that support. If you can send a thank you, if you can come sing music in our parking lots to tell our frontline people that you love them, that would mean the world to me. That's really what I want to say is we love you, Mississippi. We need you. And please believe in us because we're doing our best.